Our bodies try to tell us when something isn't right. But sometimes, it's easy to miss the signs, especially when they're not very clear. When it comes to kidney cancer, the signs are quite similar to those of kidney infections, making it more likely that you'd either confuse them with other less severe conditions or simply ignore them. And that can make it really difficult to cure kidney cancer in later stages. So in today's video, let's learn about 8 signs of kidney cancer that many people ignore. Being aware of these clues can help you catch any problems early and get the help you need. Let's begin. Number 1. Blood in urine. Blood in urine is also known as hematuria, and it can happen due to other conditions such as urinary tract infections, kidney stones, and sometimes even after a hard exercise. And that's why you might think the blood in your urine is due to a less serious cause, and not immediately connected to something as serious as cancer. In some cases, blood in the urine may not show up with pain or discomfort. This absence of physical discomfort may also cause people to ignore the symptoms. Kidney cancer often leads to the development of tumors within the kidneys. These tumors can sometimes invade nearby blood vessels or cause bleeding within the kidney itself. As kidney tumors grow, they can disrupt the normal blood flow within the kidneys, leading to leakage of blood in the urinary tract, which then mixes up with urine. Anyhow, you shouldn't ignore hematuria or blood in urine no matter what the reason is, and get yourself checked as soon as possible. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by becoming a patron. Number 2. Pain and pressure in the back. Sometimes, people don't pay much attention to feeling pain or pressure in their side or back. They might think it's just a normal ache or muscle discomfort from everyday activities. But it's important to know that this kind of discomfort can also be a sign of kidney cancer, which is a serious health issue. Let me tell you why. When the tumor within the kidney starts growing, it can cause pressure and discomfort in the back and block the flow of urine within the kidneys or along the urinary tract. This can cause back pain, particularly around the kidney area. This kind of pain is usually felt in the upper back or flank area just below the ribs, on either side of the spine. Plus, this pain may feel deep inside your body and even radiate to the lower abdomen or groin area. Again, kidney pain can also happen due to the formation of cysts inside the kidneys, kidney stones, or other kidney infections. So the best way to be sure what's causing it is by getting yourself checked. Number 3. Mass or lump in the side or back. Some people might feel a lump or bump on their side or back, and if the lump area is around the kidneys, this may be linked to kidney cancer. You can feel this lump under the skin when you touch it. It's like a small solid bump, which can be caused by the cancer growing inside the kidney. Now there's a chance that the cancer cells spread to nearby tissues or even other organs. This can make treatment more complicated and decrease the chances of a full recovery. Moreover, depending on the size and location of the lump, it can put pressure on the normal kidney tissues, affecting the kidney's ability to filter waste products from the blood and leading to kidney dysfunction. Number 4. Swelling of the ankles and legs, or high blood pressure. You can think of the kidneys as blood filters in your body. They filter excess fluids and waste products from the bloodstream and excrete them as urine. But when someone has kidney cancer, it can disrupt this process. As a result, extra fluids can build up in the body, especially in the lower parts like the legs and ankles. This can make them swell up, making them appear bigger, and sometimes feel tight or uncomfortable, also known as edema. The kidney's fluid-regulating mechanism also helps to regulate blood pressure. So when the kidneys aren't functioning properly or are compromised by cancer, this can lead to an increase in blood volume, which can contribute to higher blood pressure. Another way that kidneys help to control blood pressure is by producing a hormone known as renin. When the kidneys detect reduced blood pressure or decreased blood flow, they release renin into the bloodstream. This hormone then triggers a series of reactions, eventually causing the blood vessels to constrict or narrow, and increasing the blood pressure. However, in the case of kidney cancer and certain other conditions, the kidneys may release too much of this hormone, causing your blood pressure to rise abnormally. So if you have consistently high blood pressure or edema, despite the fact that you're careful in your sodium intake, this could be a sign of underlying kidney disease or kidney cancer. Number 5. Anemia. Our kidneys produce a hormone called erythropoietin or EPO that tells our bone marrow to make red blood cells. In the case of kidney cancer, the cancer cells can disrupt this process. They can interfere with the kidney's ability to make enough EPO. With less EPO, the bone marrow doesn't get the signal to produce as many red blood cells. This leads to a lower number of red blood cells in the bloodstream, causing anemia. It can show up in several other symptoms, like shortness of breath, weakness, pale skin, dizziness, irregular heartbeats or palpitations, difficulty concentrating, coldness or numbness in hands and feet, and many others. So if you are noticing these signs and symptoms of anemia, in addition to other signs of kidney disease or kidney cancer, then you must get yourself checked for iron levels, liver function, and kidney function. Number 6. Fatigue. Dealing with cancer can be really tough on the body. It's like your body's working overtime to fight off the cancer cells and repair any damage they may have caused. The cancer cells often take up a lot of the body's resources, like nutrients and energy. This can leave you feeling drained and tired. Anemia and low blood cell count can also cause fatigue, as I said before. Because when your body doesn't have enough red blood cells, your organs won't get enough oxygen, making you feel tired and lazy. Number 7. Loss of appetite. Normally, our bodies send us messages when it's time to eat. Kidney cancer can interfere with these signals. It's like the messages get a bit mixed up, and the person doesn't feel as hungry. Moreover, some treatments for kidney cancer, like chemotherapy or radiation therapy, can also affect appetite. They can cause temporary changes in taste or sometimes make food less appealing. Eventually, this can make you lose too much weight without even trying. So if you aren't feeling as hungry as you normally do, or don't feel like eating much, it could be because of kidney cancer. Also, as I said a while ago, cancer cells typically use a lot of energy from sugars present in your body. This consistent lack of sugar can cause unexplained weight loss. Number 8. Fever and night sweats. A persistent fever, typically with temperatures higher than 100.4 degrees Fahrenheit, can be a symptom of advanced kidney cancer. This fever is often considered a paraneoplastic syndrome, which means it occurs as a result of substances produced by the cancer cells that affect the body's normal functions, including the body's temperature. Similarly, night sweats in kidney cancer are quite intense, with episodes of excessive sweating during sleep, which can drench the bedclothes and disrupt sleep. Like fever, night sweats are more commonly seen in advanced stages of kidney cancer. So, if that's happening to you too, especially along with other signs and symptoms of kidney cancer mentioned in this video, do not ignore them and talk to your healthcare team. They can perform a few tests to find the underlying cause of your condition and get you the treatment you need. Thank you for watching and subscribing to the channel. See you in the next video.